Good morning. Today we're educating you about prevention of catheter-associated urinary tract infections, also known as Cautis. Approximately 70% of hospital-acquired UTIs occur from indwelling urinary catheters. This increases hospitalizations, morbidity, mortality, hospital costs, and hospital stays. It is also considered a never event and is the most common hospital-acquired infection. So, what exactly is a UTI? A UTI is a bacterial infection of the urinary system, and this includes the bladder and the kidneys. As you can see, there are many signs and symptoms associated with urinary tract infections. It is good to keep in mind that some older adults may have an active UTI but be asymptomatic. Indwelling urinary catheters interfere with normal defense mechanisms of the body. Bacteria can ascend the catheter in 1 to 3 days, enter the bladder by ascending the urethra from the perineum, enter from the exterior surface of the catheter, or come from other patients transmitted by healthcare staff. These factors increase the risk of contracting a Cauti. It is good to keep in mind the duration of catheterization. With each day of catheterization, the risk of infection increases. To prevent Cautis from occurring, one should avoid insertion and only place urinary catheters when necessary. Inappropriate catheter use should be avoided. It should not be used as a substitute for care of a patient, as a means of obtaining a culture, trying to mitigate a hospital-acquired pressure ulcer, or to lessen the workload of healthcare staff. Remove an indwelling catheter as soon as possible and limit the days that the catheter is in. Ensure that it is not done prematurely to avoid recatheterization, which can cause other health problems. Also, follow nurse-driven protocols and set reminders every 48 hours. It is important to keep in mind alternatives to using an indwelling urinary catheter. These alternatives include condom catheters, portable bladder ultrasound scanners, intermittent catheters, urinals, bedpans, and bedside commodes. Specifically trained personnel should perform this while maintaining sterility and using proper hand hygiene, as well as cleaning the meatus before catheterization, and always use a closed urinary catheter collection system. Elements of a bundle method can include having an intact securement device, maintenance of a closed system, continued unobstructed urine flow, leaving the drainage bag below the bladder, perineal care on a daily basis, and making sure the patient meets an appropriate indication. Team members can improve the culture of safety by having individual accountability, be a part of the team, always use evidence-based practice, engage and educate other team members. Also, realize that this is a habit or mentality change and don't be afraid of empowerment. Nurses play many roles in prevention. One can initiate removal, be an active participant in catheter reminders, never place a catheter without orders, always adhering to evidence-based practices that prevent infection, and not being a resistor but being part of the team. Let's sum up the implementations and considerations for preventing catheter-associated UTIs. Always adhere to the guidelines. Consider alternatives. Only use indwelling catheters when necessary, remove as soon as possible, initiate a surveillance protocol, and don't be a resistor. We appreciate your interest in learning how to prevent catheter-associated urinary tract infections. Please let us know if you have any further questions.
Created using Powtoon.